Hello, everyone. Today is Monday, November 15th, and joining me today and every Monday is Dr. Timothy Bray, UTD EPPS professor and director for the Institute of Urban Policy Research at UTD. Dr. Bray will give us North Texas 7-day COVID-19 trends, as well as this week give us data on the well-being of children in North Texas. Dr. Bray, can you tell us about the COVID trends this week?
Thanks, Dani. We have continued good news on the COVID front here in North Texas. As you can see from the graphics from our dashboard, we are at 6,534 new cases in the last 7 days, down from about 7,300 last week. So our cases are down. We also see that our active cases are down 15,000 from 19,000 a week ago. The number in red there, that's the number of deaths. The number of deaths is up slightly. It's up to 204 in the last 7 days from 191 the 7 days prior. One thing to keep in mind with the COVID statistics is that deaths tend to lag the actual new cases by a period of 10 to 14 days. So this is probably just a small number of additional deaths from small surges a couple of weeks ago. I would also direct your attention to the hospitalization panel in the middle. You see that we're at 90% hospital occupancy. Now, remember, that's the percent of hospital beds that are staffed and are occupied by patients with any condition, not COVID. That number is a little bit higher. I want to show you, though, what's going on with those numbers. So I'm going to go into our panel on COVID details for hospitalizations. And the number that I want you to pay attention to is the second number down there. It's the lab-confirmed COVID-19 patients in the hospital. That number is 720 for North Texas. Last week it was 777. So while our hospital occupancy is going up, the COVID patients are actually going down. This is a really good trend because what it means is our hospital beds are being freed up for folks with other serious conditions. These are some of them folks who have delayed surgeries, folks who have delayed procedures. They now have access to those hospital resources. What we need to continue doing is continuing to be vigilant. We need to keep our hands washed. We need to maintain social distancing. We need to wear masks where practicable and, visit with our physicians about getting vaccinated for not just COVID, but flu and all of the other diseases that are out there.
Thank you so much, Dr. Bray. It's always important in these COVID-19 updates, especially that we are still in the midst of this pandemic, and it is so important to stay vigilant. Now, could you please explain the new Beyond ABC Growing Up in North Texas report and data that can go along with it?
Sure, absolutely. So for folks who are interested in childhood well-being, we've had the great pleasure to work with Children's Health Systems of Texas since 2010 on an annual and biannual report on well-being of kids in North Texas. It's 6 counties, including Dallas, Collin, and surrounding counties. We study the well-being of kids in 4 areas. We look at their economic security, their safety, their health and education outcomes. One of the stats I wanted to share today is actually a piece of good news. Several years ago, it was probably close to 8 or 9 years ago, we reported a statistic in Beyond ABC that 1 in 3 children in Dallas County was living in poverty. It was alarming, but it was a statistic that had been fairly constant for a decade. We had a high degree of child poverty rates in Dallas County, North Texas in general as well. Today, we report that in 2019, there were just over 1 in 4 children in Dallas County who were living in poverty. So that number is down to 27% from 33%. And that's because of successful programs like the expansion of the Earned Income Tax Credit, moves that we've been making at the policy level with child tax credits and a variety of other things, but also an economic upturn in North Texas that has seen conditions improve for families. So we wanted to bring that bit of good news. Over the next couple of weeks, we hope to share some other findings from that report, and I'm sure Dani will share the link of where you can download that report yourself.
Absolutely. Well, thank you so much, Dr. Bray. I look forward to our update next week as well. Have a great day and week, everyone.
Thanks, Dani.